As families begin to make their fall and holiday preparations, the Florida Department of Health recommends preparing for one more important thing this fall. And we will get to the point coming up on Polk Place. Welcome to Polk Place. I'm your host, Lauren Lingell. Joining me in studio, we have Dr. Joy Jackson, the director of the Florida Department of Health in Polk County, and Tammy Durden, the director of nursing and community health. And we are so happy to have you here because I feel like you've got some information that we need to share with our viewers. So, what's on the agenda, Dr. Jackson?
We would love to talk to you and encourage our residents to get flu shots. We are starting our flu season, which usually begins around October of each year. Mm-hmm. It runs through the spring, and now is the opportune time to get your flu shot to help prevent yourself from becoming ill or infecting the community if you should become sick.
Now this is really more of this is a stand for prevention, because it's not, a flu shot's not going to help you if you're already sick. Correct.
Correct. There are a lot of viruses that go around this time of year, and the flu shot really helps to protect you against the 4 strains that are included in the quadrivalent vaccine. It doesn't prevent other illnesses, but it does help prevent the consequences of having an active flu infection.
So the quadrivalent vaccine, did I say that right?
Yes.
That's one of the most common types of vaccines that people will get.
Correct. It has components that are against influenza A and influenza B. CDC works every year to determine what's projected to be the most common virus strains for the following year, and the manufacturing companies come up with hundreds of millions of doses, which are then administered this time of year.
Now I'm going to ask a silly question because, we think the flu, everybody knows what the flu is. Mm-hmm. What separates the flu from just a common cold?
The flu has a range of severity. Some people with the flu have relatively mild symptoms. Others can have very serious symptoms. Some people actually get hospitalized, and the influenza can cause death. So there's a range, and it's partly based on that person's immunity and their underlying health conditions. There are other viruses out there that can closely mimic the flu. The only way to know for sure if you have the flu is to be tested. And many people who have the flu are not ill enough that they even seek medical care, and which makes it a little bit difficult every year to know for sure how bad the disease burden has been.
We have these vaccines, and then of course, you know why you should get them. But what about, what do you feel is the thing that prevents people from getting the vaccines?
I think some people are apprehensive of getting a flu shot. Mm-hmm. Some people feel that the flu shot may give them the flu, and I want to assure and reassure people that the flu shot will not give you the flu, because the flu shot is made from inactivated virus. The virus is not alive. So it can't technically give you the flu. Some people will have a robust immune response to the antigen, and they may feel achy. They may not feel real well for a day or two, but it's far better than getting the full-blown flu.
Now, the flu shot is offered every year around the same time. What if you skip a couple of years? Do you think that some people could have a different reaction to the vaccine, say if they didn't have the vaccine the year before?
I don't think so.
Okay.
The immunity lasts for 6 months to a year, so I don't think skipping makes you more at risk for having a severe reaction in the future if you have not had a severe reaction in the past.
So what are some of the other reasons besides guarding yourself against this virus that you may want to go ahead and get a flu shot?
Mm-hmm. I'm going to let Tammy talk about those that are most at risk for the flu and the ones that are most encouraged to get the vaccine.
Okay, great. I didn't mean to leave you out there.
Oh, no problem. the thing is, you have to take time first to get the flu vaccine, and the CDC recommends that everyone 6 months of age and older get the flu vaccine, and you need to get it before the flu comes into your community. And then, of course, those that are most vulnerable, those that are most at risk, and those would be our young children, pregnant women. Those that have health conditions like asthma and diabetes, heart and lung disease, and of course our older folks. It's interesting because pregnant women who get the vaccine, studies have shown that that actually protects their baby from getting the flu infection up to several months.
Wow.
Right, and people also taking care of young children, they need to also be protected so they don't pass that flu on to young children or older people that they live with. And we can't forget healthcare workers either. They are, they're vulnerable too, and bringing it home to their families as well as spreading it to their patients. And anybody over the age of 65 also is the most vulnerable. So we encourage everybody, 6 months of age and older, to get that flu shot.
So we were talking a little bit earlier before the show. What are, there are some people that think that vaccinations and I mean, there are a lot of vaccinations, not just the flu vaccine, but the vaccinations are really, they're risky. And you shared some very interesting historical data with me. So can you speak to that a little bit?
Sure. One of the worst flu pandemics in the world was 100 years ago, in 1918. In 1918, 1/3 of the world's population contracted the flu, and there were hundreds of millions of deaths, and 670,000 Americans died from the flu. We don't see that as much now, although it's a risk, because of the flu vaccine that became readily available in the early 1940s. Last year in America, there were 49 million cases of flu versus 1/3 of the world's population. And there were about 79,000 deaths last year in America, including about 600 children, most of whom were not vaccinated.
Wow.
So I think data and time tells us that the flu vaccine is effective as a population effort to reduce the risk of global pandemics. So strongly recommended.
So, I mean, 79,000, some people might hear that number and say, oh, that's not, in the big scheme of things, that's not very big at all. And, I mean, it is.
It's a big, very, very big number. I mean, you think of the Notre Dame Stadium, that holds 80,000 people.
So an entire football stadium full of people that died because they were not vaccinated.
Right. We don't want one single child to die because they were not vaccinated. And we know that the flu vaccine, some people will say, well, I got a flu shot and I still got the flu. Studies have shown that those who get a flu shot that do get the flu usually have a much less severe case of the flu. They're less likely to be hospitalized, less likely to have to go into the intensive care unit, and less likely to die. So every year the flu vaccine may not be 100% effective for an individual, but the consequences if you should get the flu are generally considered far less.
Yeah, so let's definitely get the word out, get people out to get a flu shot. Where can residents in the community get a flu shot?
Well, I would think their primary provider is always a good place to start.
Okay.
There's many local pharmacies, stores and grocery stores that offer flu vaccine. The health department, you can also go there for your flu vaccine. I would just caution people a little bit just to double check when they go to make sure their insurance will cover it, because some insurance companies will cover certain places and not other places. So if in doubt, call your insurance company and ask, where can I get my, my flu shot? That'll be for free. Okay.
But there are places, I believe Publix offers free flu shots, right? Is that
if you have
true?
insurance.
Well,
Through insurance.
right. So there are different types of arrangements for
Okay.
flu vaccine which is available, and there are also some places that will offer them for free. But my call not only to Polk County residents, but to all Floridians, the CDC monitors vaccination rates. In last flu season, the state of Florida was 5th lowest in adult vaccinations, 2nd lowest in the nation for pediatric vaccinations. So Florida as a whole needs to step up to the plate, and let's get these flu shots. Last year's flu season was one of the worst in history. It was definitely the worst in the past 10 years. It was global across the nation, and many, many people contracted flu, and there were many hospitalizations. So we really don't want a repeat of that as much as we can prevent it.
Right. And speaking of prevention, there are some things that you can do. For instance, get your flu vaccine first of all. And when you're out and about, make sure that, you know, when you come home, you are washing your hands with soap and water. And if soap and water is not available, you can always use an alcohol-based sanitizer. And if you are sick, stay home. You don't want to go out and spread it further. And try to, you know, avoid close contact with sick people. And, you know, use some disinfectant. If you have somebody in the house that is sick, you know, wipe those doorknobs, the TV remote controls, telephones, you know, faucets to the sink, the hand pump soaper dispenser. Try to, you know, do as much as you can to reduce the flu in your family. And one of the most important things is do not touch your face, do not touch your eyes, your nose, your mouth. That is how germs are spread.
Absolutely. You guys had a wonderful, I believe it was you who had a wonderful poster a couple of years ago with the vampires showing you how to cough,
Right.
so that you're not spreading those germs.
And that's another thing too. Use the tissue to cover, you know, your nose and mouth when coughing, and dispose of it in the garbage can, and then wash your hands with soap and water.
So the flu is spread person to person and up to 6 feet, and it's spread by droplet. So an individual who has a flu that coughs or sneezes or even speaking can transmit the flu up to 6 feet. But then those droplets fall on surfaces. Somebody else may come later and touch the surface, and then, you know, touch their face, and that's how they contract it.
Ladies, it's been wonderful having you here, and I hope that we covered everything that we wanted to talk about, because we sure do want to help our Polk County residents stay as healthy as possible this flu season, and improve our community. Yeah, so.
Thank you for the opportunity.
Thank you.
Absolutely. The Florida Department of Health recommends preparing for one more important thing this fall by getting a flu shot. The flu shot is safe and effective and remains a person's best defense against getting the flu. The flu shot is the best way to protect families and communities against the spread of influenza. Those who prioritize getting the flu shot early help decrease their risk of getting the flu. The flu shot is recommended for all Floridians 6 months of age and older on a yearly basis. For more information on the flu shot through the Florida Department of Health in Polk County, you can give them a call at 863-519-7900, or you can look them up on the web at www.polk.floridahealth.gov.